Health insurance versus critical illness versus outpatient versus hospital only versus dental versus cash plan. Which one is better for families? Choosing the right health insurance for your family can feel overwhelming. Most people get this wrong by assuming one policy covers everything, but the surprising truth is that each type of plan addresses very different healthcare needs. Understanding critical illness, outpatient, hospital only, dental and cash plan insurance can save both money and stress in the long run. Critical illness insurance pays a lump sum if you're diagnosed with a serious condition like cancer, heart attack or stroke. This coverage helps families handle treatment costs, lifestyle adjustments, or even time off work. It's not a substitute for regular health insurance but provides financial security during life-changing diagnoses. Outpatient insurance covers visits to GEs, specialists, physiotherapy, and minor procedures without hospitalization. It's ideal for families who want quicker access to healthcare without relying solely on public services, reducing waiting times, and out-of-pocket expenses. Hospital-only insurance focuses on covering inpatient treatment and surgeries. It's often more affordable than comprehensive plans, but only kicks in when hospital stays are required. For families with healthy children or minimal medical needs, this can be a cost-effective solution. Dental insurance covers routine checkups, fillings, and sometimes orthodontics. Dental care is often overlooked but can become a significant expense if ignored. Having this coverage ensures your family maintains good oral health and avoid unexpected costs. Cash plan insurance reimburses small, everyday healthcare costs like prescriptions, physiotherapy, or optical care. While not a replacement for serious medical coverage, it provides a safety net for recurring expenses that can quickly add up for a family. So, which is better for families? The most effective approach is a combination, a core health plan for serious illnesses and hospital stays, supplemented by outpatient dental or cash plan cover for routine and minor expenses. Critical illness insurance adds extra protection for unexpected, high-cost conditions. Ultimately, the right mix ensures your family has access to the care they need, reduces financial stress, and helps everyone stay healthy and secure. A well-planned insurance portfolio is about peace of mind, not just coverage.